So now we've set up our NG tube and we're going to be doing the gastric lavage procedure. I have here a suction canister. You're going to need a couple of them, and the suction tubing, the patient with the NG tube, and you want a bolus of fluid with the tubing. You're going to spike your fluid bolus and get all of the air out of the line. You're going to tell your patient what you're doing the entire way. You're going to be using the fluid to place it into their stomach, and then you're going to pull out exactly what you put into the stomach, into the suction canister. And you're going to do it a couple different times to see if the patient's still bleeding. So you're going to be able to compare side by side. The first should be filled with old blood, hopefully. The next should be a little bit clear, and the next should be clearer until you see no more blood. If there is still more blood in each one, the patient's probably still having a gastric bleed. So after you've told your patient what you're doing, you're going to take your line, and you can do it a couple different ways, but you want to remove this little extra piece, and you should be able to pull out from this little part here. You're going to pull out the tubing, and you're going to place it into this cavity right here. And it's kind of loose, so you want to hold it down to make sure there's a seal so none of the fluid comes out. So when you're doing the gastric lavage, I marked it here on the fluid container. You're only doing 250 milliliters into the patient each time, and you want to bring that same amount out each time. The maximum amount that you can do is 2 of these 1,000 liter bags. So that's going to be 2,002 liters. All right. So now you're going to run the fluid through the line, and it's going to come down to that 250 mark. When it hits the 250 milliliter mark, you're going to stop the fluids. You're going to remove this for now, and you're going to hook the patient up to the suction, but you're going to need that little piece again. Okay. So once you've done that, you're going to place the suction on medium continuous, and you're going to suction out everything you put in. So let's say we got the first little bit out, 250, maybe 240 milliliters on here. You're going to stop the suction, and it's going to be the same thing again. You have a new canister because you want to start fresh, see what exactly has changed since the last time. You're going to attach that end piece here, hold down tight, and let the fluids run again until it hits the next 250 milliliter mark. Once that's done, stop. Same thing, you want to connect back to suction with your new canister and see if anything's changed. You're going to keep the nurse and the doctor updated with what's going on. If you leave the patient bedside for some reason, you need to put it on intermittent and on low, not on continuous medium.